Okay, guys, so the very last part of this is actually going over this list of homeostatic imbalances. So let's pull out some paper and let's get going. So I'm going to write this on a separate sheet just to make it a little bit easier to see. So here. So we are going to start with rhinitis. Let me make sure I have this so I can, as we go through them, look. Okay. So this is just the inflammation of the nasal mucosa. This can lead to sinus headaches. And essentially, the nasal mucosa is just the continuation with the mucosa of the respiratory tract. So essentially what happens is infection spreads from the nose to the throat to the chest because it just kind of moves since it's all interconnected. It can also spread to things like tear ducts and the paranasal sinuses. So this can cause a blockage of sinus passageways, and it can lead to things like absorption of air, production of a vacuum, and then essentially that results in sinus headaches. The next thing we're going to talk about is laryngitis. And this is inflammation of the vocal folds. So what happens here is that the vocal folds will tend to swell, and this interferes with the vibration. This results in a change to vocal tone. It can cause hoarseness in some extreme cases. It can limit your speech to merely a whisper. Most of the time, it's caused by things like viral or bacterial infection. It can be due to overuse of your vocal cords, dry air, or tumors on the vocal cords. Sometimes it can even be due to inhalation of irritants. Pleurisy is essentially the inflammation of the pleural membrane or pleura. And most of the time, this results in pneumonia. Or results from. So what makes this thing so bad is that the pleural becomes inflamed, thus making it rough. When it's rough, then most time it can result in a production of friction and stabbing pain that you essentially do not have with each breath, right? Also, what can happen is the pleural may produce excessive amounts of fluid. In that case, it can exert pressure on the lungs and it essentially can hinder breathing. Pleural effusion. This is essentially when fluid accumulates in the pleural cavity. So, and this is not just always pleural fluid. It can be things like blood that leaks from damaged blood vessels or blood filtrate. That can be basically the watery fluid that oozes from lung capillaries when the left side of the heart fails. So these are basically it's any kind of fluid accumulation that happens in that pleural cavity. The next thing we have is infant respiratory distress syndrome. And basically, this happens from an insufficient quantity of surfactants. In the premature infant. I'll give you a second to catch up here. And so essentially, when we were talking about surfactants earlier in the lecture, surfactants were essentially released by those type 2 alveolar or alveolar cells. And those help in looking at that surface tension. Remember when we were looking at alveolar surface tension? And we were talking about how water has a large surface tension. And so what can happen with that is that if the surface tension is too great, then that will promote the alveoli to basically collapse. And so this surfactant is basically like detergent like lipids and protein complexes that help to reduce that surface tension. So if you do not have those there, right, what essentially will happen is that that surface tension becomes too great and you'll have the collapse of the alveoli. So collapse of alveoli, right? After each breath. This makes breathing so much more arduous, right? So a lot of times what they'll do with treatment, they'll either give a spray. Oops, let me go here. For treatment, they'll have a spray that actually has the surfactants in it, and they'll put it into the newborn's air passage to help with that pressure or to combat too much of that surface tension so that it can open up and allow them to breathe. Or they can do what's called mechanical ventilation if that doesn't work. And mechanical ventilation is a process that will actually use machinery to help them breathe. Now, there is something that can come from mechanical ventilation, which is called bronchopulmonary dysplasia. And basically, that's a chronic childhood disease that develops from mechanical ventilation. So there's a fine balance of making sure to use what's best for the child so they don't end up developing a lifelong lung disease. Now, with that being said, let's go and start talking about if you're having problems breathing or not being able to get adequate oxygen delivery. That is a term known as hypoxia, right? Inadequate O2 delivery. And this can result in what's called a cyanosis. And cyanosis is the case when you look like you're turning blue, right? So this can be seen in cases where you have things like pneumonia or left heart failure. Because if you remember from the left heart or the left ventricle is what pushes all the oxygenated blood to the rest of the body. And so this can be a problem sometimes if you're, and the reason why you see this in things like pneumonia, that the thickness of the respiratory membrane increases dramatically if the lungs become waterlogged at all. Or edemesis, which means that they accumulate fluid. So it makes it harder for oxygen to mediate through it or diffuse through it. Hypoxia is generally based on cause. So we have anemic hypoxia, which just means there's too few red blood cells, or there are abnormal or too little heme groups, so they can't carry oxygen. Ischemic hypoxia is impaired or blocked circulation. Histotoxic is basically cells are unable to use oxygen. So this is as in metabolic poisoning. Or metabolic poisons. So you can think of things like cyanide here. Hypoemic. This is abnormal ventilation. And this essentially happens from pulmonary disease. And things like carbon monoxide poisoning. Kind of fits into, though it's not quite hypoxia, it's separate, but it kind of fits into all of this, because in that, this you normally see as a result of fires, or sometimes people leave their cars on in the garage. And just to let you know, carbon monoxide has a 20-fold greater affinity than oxygen when bound to a heme group, right? So carbon monoxide poisoning can be a problem because hemoglobin would rather bind carbon monoxide than oxygen. And because it's bound carbon monoxide, it can transport oxygen through the body. Now, COPD, which is known as chronic obstructive pulmonary disease, you normally see this, the most common history for people to have that have COPD, about 80% of people with COPD have been smokers. They have what's called dyspnea. And that's just a technical term for labored breathing. So you can think a lot of times it's like air hunger, right? That it looks like they're just trying to breathe and it's really hard. You normally tell a lot of times that they end up having a lot of coughing and frequent pulmonary infections. Now, most people develop what's known as hypoventilation, which basically is just a reduction in the breathing rate, right? Reduced breathing. And so this leads to what's known as respiratory acidosis. And acidosis is a decrease in the blood pH. And that essentially comes from an increase in carbon dioxide because they can't get rid of it fast enough. With this COPD, their innate strength of patient's innate respiratory drive is a reason behind why you see different symptoms. So essentially, you might see what's known as what's called pink puffers. These patients are normally thin, and they're thin because they burn so much energy trying to breathe. Okay. They normally, because of this, they have near normal blood gas concentrations. And so no color change. Now, the other things you might see are known as blue bloaters. And these patients are normally stocky. Or we're talking about being thin, right? They're normally stocky. They have what's known as cyanosis again. And if you remember, that's due to that blue color that you see through the skin. Your blood is not really blue, but it gets that kind of blue color due to the seeing the light kind of going through the skin. And so essentially they get this blue tint to them. And that's because of the reduced oxygen concentrations in their body. And so sometimes, with treatment here, they do bronchodilators. They can do corticosteroids. They can give them oxygen, right? They can sometimes go for lung volume reduction surgery. And in this, the biggest thing, especially the oxygen, you just have to be careful how you administrate it. Now, sometimes you'll see within them something known as emphysema. And what happens here is this is when the alveoli are permanently enlarged. And because they're permanently enlarged, right, it decreases the elasticity of the lungs. The lungs are less elastic, so essentially you have to use accessory muscles now. So remember when we were talking about having to use the pectoralis minor muscles whenever you do deep breathing, or having to use the internal muscles that you have, the intercostal internal muscles versus just the external for deep breathing. Now, just to get a breath, you have to invite those accessory muscles to help you breathe. So you end up being exhausted because you're using 10 to 15% more energy. Right? Because your lungs are basically not able to collapse the way that they were, right? Trapped air essentially in there will cause hyperventilation, which is going to flatten the diaphragm and cause expanded barrel chest, both of which reduce ventilation efficiency. So hyperinflation is going to happen. Damaged capillaries are also seen in emphysema. And this can lead to actually an enlarged right ventricle. And sometimes you can see this last part being hereditary. So that's emphysema. Chronic bronchitis. And we are almost done here. So here you can get an excess of mucus. This normally happens from something you've inhaled. From here, the mucosa of the lower respiratory system ends up becoming inflamed and fibrotic. That leads to obstruction of airways. And gas exchange. So a lot of times with these, you get a lot of pulmonary infections. And you can have it happen more if you smoke or you live around a lot of pollutants. Asthma, sometimes classified as COPD, but the episodes are acute, where COPD is chronic. So you will have actually symptom-free episodes where nothing's any problem, right? And so what this is an active inflammation of airways. It can cause coughing, labored breathing, wheezing, and tightness in the chest. This inflammation, right, is normally an immune response. Tuberculosis is an infectious disease caused by Mycobacterium tuberculosis. It can be treated with 12 months of antibiotics. You feel like crap. You get fever, night sweats, weight loss, coughing, and the most common that we know is coughing with blood. And the last that we're going to talk about here, lung cancer. This is a leading cause of cancer deaths in North America. %90 of all cases that result from lung cancer come from smoking. And this is essentially how my mom passed away. And so there's 3 common types. There's adenocarcinoma. This accounts for 40% of the cases, roughly. And it originates from peripheral lungs, so it develops basically in the bronchial glands and the alveolar cells. The one my mom passed away from was squamous cell carcinoma. This happens about 20 to 40% of the cases. And this rises from squamous cells, essentially, specifically, and the bronchial epithelium. And the last is small cell carcinoma. This is about 20% of the cases. And it contains lymphocyte-like cells that originate in the primary bronchi. So primary bronchi is where this comes, or main, right? And this is the one that is most able to metastasize, which basically means it can go full body. And so we are done with our amazing time here, and I will see you next